started, right? Right, thank you for having me tonight. What I will do, you just visited with one organization. I'm going to take you on a trip to Uganda, but you want to go through security at the airport. My name is Mr. Jackson Kazuri. I was born and raised in a tiny village in Uganda, and here is the map of Uganda. When you think of Uganda, think of a country with 32 million people. Half of the population is less than 15 years old, and 2.2 of those are HIV and AIDS orphans. When we speak of Nyaka AIDS Orphan School, this is Kampala, the capital city of Uganda, 8.5 hours drive to Kanungu, which is in that corner. That 8.5 hours drive is going to take you to everything you know, like a downtown city, to the poorest village you will ever see. In that village where I was born and raised, my parents never went to school, but they strived to make sure all 5 of us get an education. To get that education meant to sell something in a house all the time. For you to get to school, they had to sell chickens, they had to sell goats, they had to sell cows, they even sold part of our land so we can get an education. Why would a parent do that? The only way to break the cycle of poverty and deprivation for you as a child is to get an education. Now, speed it up, take it to 1980s and 90s. HIV/AIDS comes and sweeps through sub-Saharan Africa, killing all these men and women whose parents had worked so hard to educate, to send to school, whose parents were waiting in the villages for these men and women to come back and take care of them. These men and women are dying at a fast rate, leaving behind children who have nobody to take care of them. Those men and women included my brother and my sister, and that's what took me back to the village. I left as a boy, came back as a man to build a school now for HIV/AIDS orphans. A school that doesn't only provide education, but also provides other services. We take a holistic approach, make sure they get food every day, 2 times a day, make sure they have health care, make sure they have a farm where they practice farming, make sure they have clean water system in the whole entire village. This is a village of 25,000 people within a district of 250,000 people. And one shocking statistic, all those 250,000 people are served by 1 doctor. Men and women are born and they die without ever seeing a doctor. Our health care program addresses that problem. Children like Aaron who are born crippled, who would be hidden in the back of the rooms forever, we've been able to get him out and take him for surgery, and now Aaron walks on his feet. Children who get to school now and advocate on their behalf, have a voice to talk about themselves, and or even go in the farms and grow food. Food they know they will grow, eat for lunch, but also take home in the evening. Children who now serve, get porridge and drink it themselves. Children who are now for the first time smiling in the first time in their entire lives. But we've taken health care beyond just the school, providing it for the whole entire community. We have received money to build that clinic. A clinic, the first one of a kind in this village. A clinic where women will birth for the first time, have a child in a room. Because children like me and many of us who are born in this village are born either on the side of the road or somebody's walking and the baby pops out. Children who die all the time because they can't afford a razor blade. The money we are asking for tonight, £5,000, will help us to equip that clinic with materials, with beds, and with also buying an ambulance. Not your typical ambulance with wee, wee, wee. This will be a van that can transport a child who is bleeding to death from a village 3.5 miles from our village to the clinic. Women who are getting complications while they are giving birth there will be able to take them to the hospital. But we've also gone beyond healthcare. We provide a clean water system for the entire village. All 25,000 people get clean water. When we think of clean water, me and you think of your bathroom, you turn on the pot, you have water. These men and women in my village, especially girls and women, have to walk 2 miles to go fetch water. While they are walking these miles, many men, many men have raped these young girls and these women. Having water in this village now has taken away that problem, but has also provided clean water. Having health care in the area has also helped us keep all girls in school. Girls who usually during their periods will not go to school. A monthly cycle begins because women use plant leaves in my village. They can't walk 7.5 miles. They miss going to school. We've solved that problem. We've solved it, and you can see the results right there. All girls and boys who started in our school have graduated. But they would not have done that without the hard work of the grandmothers. Grandmothers who were left childless, without anybody to take care of them, who stepped in now and provided microfinance loans. Outside you will see the table to have baskets, beautiful clothing they wear. They make these baskets, we give them $75 per woman, and they are able to make a living just doing that. So whereas you think of your support tonight, also think of the pencil. If you've ever owned a pencil like this, in my village, a child will drop out of school because they cannot afford a pencil. A pencil in Uganda will cost you 1 pence. But today, as we speak in London, a child will drop out of school in my village because they can't afford a pencil.